Good afternoon, everyone. Okay, so we have told that we will start from chapter number 27. Is it?
Yes, sir.
So start reading without wasting any time.
So just give me a minute. Disease classification, the syphilitic stigma. Oh, this is 26.
27. Chapter number 27. 26 we have completed.
Page number 218. In my book. It has been said that the patient affiliated with the syphilitic trend suffers from structural changes. Yet the emotional sphere in the purely syphilitic patient is not seriously affected. For this reason, in the
Underline,
syphilitic
underline this. And give me a second, I have to close the window. There is so much noise. Okay, let's start. Underline
for
this.
this
Emotional sphere is not seriously affected.
okay. For this reason, in the syphilitic patient we find less subjective symptoms. There is little of supersensitiveness and less desire, cravings and longings that in the soric patient. The syphilitic patient actually suffers much less than the soric. The mental sphere has not been so much invaded, for the syphilitic stigma is not so thoroughly established through untold centuries of time as the soric. And because it is not so thoroughly a part of the very essence of man's spirit, we have a far better chance to eradicate the dyscrasia.
Underline this.
The very earmarks of the various stigma show their respective characters. The soric itches and appears unclean, unwashed. The syphilitic ulcers and the bony structure is changed. The psychotic infiltrates and is corroded by its discharges.
Just tick mark this whole paragraph. Various stigmata show their respective character. Okay, the soric itches, syphilitic ulcerates and bony structure changes, and psychotic infiltrates. So this whole paragraph is important. This is showing the character of all three stigmata: the soric itches, syphilitic ulcerates, and psychosis endurate. Next.
Sora is the stigma which shows little on the side of the objective symptoms, but
What does
expresses
this
itself.
mean? What does this mean? The pathology is less common with the soric patients. Pure soric patients. The pathologies are less common. And with a pure syphilitic patient, the subjective symptoms, functional symptoms are less common. Okay.
Okay. But expresses itself through the mental and emotional reactions. For this reason, the patient of a tubercular diathesis reflects many subjective symptoms in the comparison with the purely syphilitic, for, as has been pointed out before, the tubercular is the combination of soric and syphilitic. It, in this
Underline this.
combination,
The tubercular is combination. We have discussed it again and again that tubercular is combination of syphilis and soric, and according to JHLN, it is also possible to have tubercular state in soric and psychosis. Okay, but according to Robert, this is the line what we have to keep in mind.
Okay. In this combination, we find all the mental and emotional reactions, the subjective symptoms of the predominant parent,
Parents.
Sura, parent, Sora, and the pathological and destructive changes of the younger parent, Syphilis.
Here, keep in mind that Robert is already telling that tubercular means Sora is the tubercular means Sora is the predominant miasm. Robert is telling, but this is not the case. Sometime in tubercular diathesis, you will get syphilis as predominant. Okay, remember this. What I'm trying to say. See, in tubercular state, what I'm trying to say actually, in tubercular state, three conditions are possible. Four conditions actually are possible. Okay, one is Sora plus syphilis. Okay, other is Sora plus psychosis. Okay, each one will have two state. Okay, as this one will have as soric dominance or syphilis dominance. Okay, psychosis. This one will have soric dominance and psychosis dominance. Okay, got it? Getting my point? Now this soric dominance and syphilitic, sora syphilitic. Okay, soric dominance, tubercular diathesis of sora syphilis, syphilis dominant tubercular diathesis of sora syphilis. Okay, soric dominance diathesis of sora psychosis, psychosis dominance diathesis of sora psychosis. Getting my point? So altogether four type of state are possible. Got it?
Yes, sir.
Okay. So here Robert is presuming that this tubercular diathesis where sora is the parent, dominant parent. This is not always the case. In tubercular diathesis, syphilis may show its dominance. Okay. Next.
Syphilis alone has few cravings in the way of food. It is averse to meat. But
Underline this.
aside,
Underline this. Hours to meet. Hours to meet.
but aside from that negative symptom, there is little that we note in the way of appetite. Compare that state with the tubercular cravings which were pointed out in the last chapter. The frequent unsatisfied hunger, the cravings for meat and potatoes where nothing else will satisfy, the cravings for salt, craving for indigestible things, the inability to assimilate much starch, the marked symptom of appetite shows the soric percentage of the tubercular diathesis.
Parentage of tubercular diathesis. Okay. Acha, can you name a medicine where we get in the Allen's keynote where we get inordinate craving for meat in patients of tubercular parentage? Inordinate craving for meat in patients of tubercular parentage, in children of tubercular parentage. It's MACCARB, okay? MACCARB. Go to MACCARB and underline this. Okay, this tubercular parentage have craving for meat, okay? And syphilis has aversion for meat. So this, if that kind of uh, patient you are getting, if that kind of patient you are getting, where sora plus syphilis was there, and sora is dominant miasm, Sora is dominant miasm, then you will get inordinate craving for meat. Okay, if you are getting syphilis as dominant miasm, then you will get what? Then you will get what?
To meet.
Okay, you will get the craving for aversion to meat, and still it is a tubercular child. Okay, I have told no. There are two states where Sora is dominant over syphilis. Still, it is tubercular. Syphilis is dominant over soric state. It is tubercular. But you will get the features of dominant miasm. You will get the features of your dominant miasm. Which miasm will be dominant? The features will be shown, and that is the way we are treating. Okay, according to dominant symptom present. Next.
In the syphilitic soric type, we find the changes in the chest wall, which are structural changes in the bony
What are
contours.
the changes in the chest wall? What are the changes in the chest wall?
Pigeon-shaped chest.
Okay, this is a pigeon shaped chest. In general, what are the changes in the chest wall? Name some deformities of the chest wall. Name some deformities of the chest wall, and how you assess these deformities. How you assess these deformities? uh, Go to clinical medicine book, whichever you follow, and try to read that chapter: inspection, palpation, percussion of the chest wall, and there you will get in inspection the shape of the chest wall. You will get barrel shaped chest, you will get pigeon shaped chest, you will get flat chest. All these are the deformities of the chest wall. Okay, go and you will go to that book, whatever you are following. Maybe you are following Hutchinson, maybe you are following this MacLeod or Sunil Sen or Kundu. Okay, whichever book you follow, just go and read that part. Okay, you will get many thing new there. So this particular deformity of pigeon shaped chest, okay, is found in tubercular children. Narrow chest wall. Next.
The chest wall is narrow and may be more shallow than normal. Even the action of the diaphragm is limited. While there may be no structural change in the lung itself, there is less air capacity and less residual air in the lung. The very structural changes eventually bring about occlusion of the air cells and the formation of foci. For these people are very poor breathers. The pumping power is so cramped that they are incapable of supplying sufficient oxygen for the body needs. This is shown in anemic and chloritic condition as well as in the tubercular. The tuberculosis produces its destruction by first cramping the arteries,
Aeration
aeration
of the
of
red blood.
addition of the through the formation of bony structures. Because is a difficult become averse to and will survive for a long time in a closed breathed order atmosphere.
Breathed over atmosphere. Underline this. You will find those who are living in the hostel. You will find uh, some people are desiring their windows open. रूममेट्स में ये प्रॉब्लम अक्सर होता है. एक को दरवाजा खिड़की खुला चाहिए, एक को बंद चाहिए. They are according to their dominant miasm. Okay, according to their breathing capacity. Those who are needing the fresh air are predominantly soric, and those who are averse to fresh air are predominantly, जिसको दरवाजा खिड़की सब पसंद है बंद करके रहना, those who are averse to fresh air are actually psychotic or syphilitic. Okay, there are lots of noise. Let me close the another window too. and anemic and chloric. Regarding anemic and chloric, this is not the only reason the syphilis is causing anemia. Okay, anemia may be caused due to thalassemia, the gene defect. Okay, which is a mixed miasmatic trait. Thalassemia, those who are thalassemic carrier, you will see that their hemoglobin are not rising above 10. Okay, their chest wall is normal, their all the features, external features are normal. Still you will see those patients that their hemoglobin are not rising above the level 10 or 9. This is normal for them and they are thalassemic carrier. Okay, maybe this is due to aplastic anemia. Everything is fine, but bone marrow is not forming the bone marrow is unable to form the hemoglobins. Okay, RBCs here. So these are the mixed miasmatic trait, deep dyscrasia, which is causing anemia. There may be another kind of anemia which we know by the name of pernicious anemia, where B12, the extrinsic factor, is unable to absorb by the stomach mucosa. Again, this is a structural change, okay, in the mucosa of the this stomach. So this is also a syphilitic taint or a mixed miasmatic taint. So anemia is not, what Robert is saying, is not only due to chlorotic condition, pale condition, is not only due to this bone wall or bony changes of the chest wall, but it may be some deep dyscrasia of the patient, which the gene he is carrying from his forefathers. Okay, next.
Long before tuberculosis develops, sometimes even years before, you may notice a symptom of the latent diathesis.
Acha,
On the
make it sure that every tubercular diathesis patient will develop tuberculosis. This is not necessary. Okay, every tubercular Robert is explaining tubercular diathesis in terms of always tuberculosis, 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 because tuberculosis was such a dreaded disease at that time that they classed a patient that this patient is going to develop tuberculosis. This patient can never develop tuberculosis without the favorable circumstances to that. Okay, और ट्यूबरकुलर डायथिसिस है तो ट्यूबरकुलोसिस होना है ऐसा नहीं है. ओके, एंड ट्यूबरकुलर डायथिसिस है तो पेरेंट्स में ट्यूबरकुलोसिस होना है ऐसा भी नहीं है. फैमिली हिस्ट्री में ट्यूबरकुलोसिस होना है ऐसा भी नहीं. ट्यूबरकुलर डायथिसिस इज ट्यूबरकुलर डायथिसिस विदाउट एनी नेम ऑफ द डिजीज. ओके, क्लियर? Tubercular diathesis is not attached to named disease called tuberculosis. Clear? Whether there is a family history of tuberculosis or not, whether there is a personal history of tuberculosis or not, the patient still may be tubercular diathesis of the tubercular state. Okay? Be this thing clear in your mind. Next, as if the Robert is always explaining tuberculosis, tuberculosis, tuberculosis. So tuberculosis disease is falling under tubercular diathesis, but tubercular diathesis is such a wide term that it cannot be encompassed with the tuberculosis of the lung, of the bone, or any part of the body. Clear? Next.
Yes, sir. On the least exposure to cold, the patient develops a deep hoarse cough. This will be repeated many times before there is actual development of tuberculosis. The purely syphilitic patient has a short, barking cough. This is sometimes true of early tubercular stage.
Underline this. Purely syphilitic patient has a short barking cough.
The tubercular expectoration.
What is cough of Mercurius?
Cough, dry, fatiguing, waking.
In two paroxysms.
worse at night and from warmth of bed with utter inability to lie on right side.
Just underline into paroxysm. Okay. Now go to tuberculinum. Tuberculinum. Your fan is giving a classical sound, Anirban.
Okay, sir, I will turn it off.
No. Don't need to turn. I am hearing your fan sound. No need to turn off.
Okay, sir.
So you will get here text cold easily without knowing how or where.
Yes, sir. Takes cold easily
Underline
without
this.
knowing.
Recurrent cough and cold. Recurrent cough and cold is the indication of tubercular diathesis. Recurrent cough and cold is the indication of tubercular diathesis.
Sir, is this recurrency for the dominance of soda?
This is both for syphilis and sora. कुछ तो अपना फीचर भी रहेगा ना ट्यूबरकुलर स्टेट का.
Yes, sir.
कुछ माँ का लिया, कुछ बाप का लिया, कुछ बच्चे का भी अपना रहेगा ना.
Yes, sir.
Okay. And I wanted to show you that cuff paroxysm. See, go to sternum.
Cough, deep, hollow, shattering, strangling, concussive in paroxysm of 3 cups.
Okay.
Of
Here it is T cuff. और sternum का कैसा था? Sputum कैसा था sternum का? What was the taste of sputum for sternum?
sweetish and salty.
Okay, and which diathesis it is? Which miasm it is?
Syphilitic.
कब छोड़ दो, मायजम बोलो. इसके बेसिस पे, स्पूटम के बेसिस पे.
Soda.
Sweetish and
Tubercular.
tubercular diathesis.
Yeah,
Okay, and
tubercular.
syphilitic. Now go to calcarea carp and read the cuff. Single paroxysm. Got cuff in calcarea carp. What is actually single paroxysm of cough? This is tubercular patient. Okay, it's not. I'm not finding here in the Allen, but mercurius in the Allen it is 2 paroxysm. That is, हम आपके हैं कौन? सलमान खान, माधुरी दीक्षित. Cough. Okay, this is mercurius cough, but tubercular cough. Single paroxysm. Just from now onward, you will be observing the coughing people, those who are coughing. What is this? This is minute gun. What you are finding in this Drosera, crocus. Okay, whooping style, paroxysm of cough. Okay, but in paroxysm of 4, 5, 6, but tubercular will always have a single bout. This is tubercular. Okay, a 2, 3. We are counting up to 3. More than 3 is going to rapid whooping type of cough. Okay, medicine will be changed according to this paroxysm. Now you will be observed from now onward. You are going to observe the paroxysm of cough. Whoever comes to you for their cough complaint, or whoever you are listening coughing, you will try to assess the paroxysm, how many times he have coughed. Okay, whether he was single, whether he was double, or whether he was triple. But most important is for diagnosis of diathesis is single cough, and you will get this cough recurrently among your family members, among your relatives, among your neighbors. They will cough in single because this tubercular diathesis is so common. Okay, those who are affecting recurrently with cough and cold, they are coughing in single paroxysm like this. Okay, now come to our basic topic.
The tubercular expectoration is purulent, greenish, yellow, often offensive, usually sweetish or salty to his
Okay,
taste.
got it? Usually sweetish or salty, tubercular diathesis, and this is because of syphilitic parentage.
We can usually depend upon the salty or sweetish taste as being a characteristic of this dyscrasia.
Underline this.
There is the everlastingly tired feeling of the tubercular type. The shriek is always ready to lie down. The tubercular patient is better in daytime and worse in nighttime.
Underline this. And showing the influence of syphilitic.
Syphilitic, okay. The syphilitic patient should be shunned or sibling in type, for they are always better during the daylight hours and all conditions are aggravated by night. The tubercular people suffers from neuralgias, prosopalgias, sciatics, insomnias, hysterias, and all the nervous symptoms peculiar to the diathesis. They may have for years persistent headaches. These may precede the actual tubercular development. Hysterical and other nervous system symptoms often preceded the tubercular manifestation, and when the lung condition improves, the hysteria will return.
This is what we have read in aphorism number 38, in example number 4, where it was given that tubercular is when the thiasis was there, mania was not there. When mania was there, thiasis was not there. This we have read. Aphorism number 38.
Yes, sir.
When two similar diseases meets together. In example. Next.
When the hysteria improves, the lung conditions takes on renewed activity. Often a severe dysmenorrhea will stay for a time. The disease progresses in the lung itself. In other words, the pre-tubercular manifestations are more soric than syphilitic.
Underline this.
But the
Pre-tubercular, by pre-tubercular, what Robert is meaning? The actual, from the actual development of tuberculosis, before the actual development of tuberculosis. That is,
but the
Robert is meaning by pre-tubercular stages.
okay. But the structure predisposing to develop the lung condition is syphilitic. When children cry out in their sleep, we may take this to be an indication of tubercular diathesis.
Cry out in sleep, tubercular diathesis. How many children you have seen that they are all of a sudden sleep broken and started crying? When the children cry out in sleep, this indicates a tubercular diathesis. You will get patient parents complaining that रात में डॉक्टर साहब रात में डर जाता है, मेरा बच्चा रात में हमेशा डर जाता है. अब क्यों डरता है, कैसे डरता है, किसी को नहीं मालूम. ये this may be a tubercular diathesis, not maybe, it is a tubercular diathesis, and often the indicated medicine you will get calibrom and borax. Okay, तो उसमें differentiate करना होता है. You have to ask your patient that when the baby was asleep in the hand of or lap of the mother and father, and when he was going to put him on the cradle or on the bed, child all of a sudden started crying. Okay, this shows the downward movement aggravates of borax, and the child get out of sleep, or after sleeping for some time, all of a sudden child started with a cry, started with a cry. So this is a tubercular diathesis, and often this is the indication for calibrome. This is so.
Rashmi,
Audible. I thought I had a network issue.
सर सर का कॉल आ गया क्या?
Sis, sis.
Okay, there was a again I was disturbed into this call. Okay, what we are talking about?
Child of Calibrum.
Okay, okay. Sorry again for that is so much disturbing calls are there. So I was talking about that this symptom you will get most often in your patient, that child cries out in sleep. Okay, so this is a tubercular symptom, and this is you may find in some kind of meningeal irritation. Okay, B is encephalitis, B is meningitis. Any meningeal irritation will cause this symptom. Okay, again this is a syphilitic. If the meninges is irritation of the meninges is there, this you can easily termed as syphilitic predominant symptom. Okay, next.
Which may take on a meningeal, meningeal from when it develops. Look carefully to all night aggravations, especially in children, to see if they are not pre-tubercular indications. The tubercular diathesis has many heart symptoms showing the soric percentage. There is much palpitation in the
Parentage. Parentage, okay, not percentage.
what's that?
Parentage, not percentage. This is parentage.
Okay. Sorry, sir. There is much palpitation in the soric. This is due to uterine or gastric irritations and disturbances. In the psychotic patients, the heart manifestations are reflexes of rheumatic conditions. In the
Underline this.
syphilitic,
Have you heard about rheumatic fever? What kind of fever it is? It is licking the joint and biting the heart. Famous quotation for rheumatic fever is licking the joint and biting the heart. Heart affection of rheumatic origin. Next.
in the syphilitic and psychotic stigma, we find little mental disturbances accompanying the heart conditions even when the conditions are critical. It is the soric patient who worries about his heart condition and rarely succumbs to it. It is the syphilitic or psychotic patient who may have for years a slight dyspnea and occasionally slight pains, or perhaps no symptom at all, but they die suddenly and without warning.
Underline
In the
this.
tuber
Just die suddenly without any warning. Psoriatic patient will have lots of heart symptoms, lots of subjective symptoms, and lots of trouble related to heart. But all those are functional symptoms. Okay. But syphilitic patients are not giving those functional symptoms, and all of a sudden, without giving any warning or time, they will die. Next.
in the tubercular as in the soric heart condition, the patient want to keep still. They are much aggravated by higher altitudes, cannot climb stairs or ascend hills, cannot breathe well on ascending, have not the proper amount of room for air. They have no difficulty in descending. With this heart condition, there is a cyanosis and is often painful. There is a gradual feeling away in flesh in these conditions. The syphilitic dropsy and anasarca are greater than the psychotic.
Underline this.
Lymphatic involvement of the abdomen is of tubercular origin, as are the hernias. The muscle lack tone.
Underline this lymphatic involvement of abdomen. What kind of lymphatic involvement you will see in the abdomen? What are the lymph nodes in abdomen? Okay, mesenteric lymph nodes. Okay, paramesenteric lymph nodes around the aorta. So lymph nodes of the abdomen are involved inside. Most means in most of the cases, most common affected lymph nodes in abdomen. Colic. A child is complaining of colic, and on ultrasound, you won't get anything until and unless the child has gone through CT scan of the abdomen. You will find that paramesenteric or mesenteric lymph nodes have been enlarged. Okay, most often these days I am finding these cases in my clinic where child is complaining of colic without any pathology in the abdomen on ultrasonography, but on CT scan you will find that there is mesenteric lymph node, enlargement of the mesenteric lymph node, and that is sometimes painful, and this is our tubercular condition. Any lymph node affection of any lymph node is of tubercular condition mostly. Next.
Hereditary syphilitic troubles in children sometimes produce a very watery discharge that almost completely drains the system of its vital fluids, and unless promptly corrected, death ensues. The cholera infantum types of diarrhea and syphilitic. We
Are
often
syphilis.
find
Underline this.
diarrhea are We
Cholera
often
infection
find
are syphilitic. Hereditary troubles in syphilitic. We have talked about first illness. First illness are the load of the which nature try to repel. In the first illness is profuse diarrhea. Profuse diarrhea. First illness was profuse diarrhea. Patient complains that it was diarrhea. Parents complain that it was diarrhea which my child suffered from. We show the child is inherited this profuse diarrhea as a first illness. Eczema as a first illness. Okay, and induration is as a first illness. Okay, next.
we often find tubercular diarrheas which simulate the cholera infectum, but they do not as rapidly drain the system. In the tubercular diarrheas, we find aggravation in the night or early morning, driving the patient out of the bed, and aggravated by cold, showing the syphilitic relationship. The tubercular child often cannot assimilate cow milks in any form.
Underline this.
The casein has to be modified before it can be digested at all. These are the children who have undigested card in the loose stools. There
Okay.
is a close relationship between the ability to take the lime salts from food and these diarrheas of tubercular children. This is the reason for difficult and irregular dentition and craving for the elements which the body needs. They cannot assimilate the necessary elements for their food. The diarrheas of the syphilitic child who is strongly tainted with psychosis will probably call for some remedy as crotontic or sarsaparilla.
Underline this. This is often your question in MCQ. What Robert has suggested, which medicine Robert has suggested for the diarrhea in children, syphilis, and to some extent of psychotic tent, protontic and sarsaparilla. Next.
The tubercular stool is apparently to be slimy, bloody, with a musty, mouldy smell, nausea and gagging before stools, and prostration with a desire to be left alone after stools. Hemorrhages from the rectum are signposts of tuberculosis. Although there are bleeding hemorrhoids in psychosis,
And underline
tubercular
this signpost of tuberculosis. Hemorrhages from rectum are signpost of tuberculosis.
tubercular patients are troubled with the pinworms and seatworms.
Underline this. We have read no in during our discussion of worms theory during introduction of the organon. We have discussed this point that Robert is telling what Hahnemann was telling that worms are the sphoric patients are affected by worms. Okay, Hahnemann's theory. Now, Robert is telling that this worm may be tubercular, and we have discussed snail worm or that red worm in the urine, the bladder worm in the urine, that is of psychotic origin. So, depending upon the type of worm and where it has affected, we can decide the miasm. If neurocystic sarcosis, it has gone to brain. Okay, so you can think that a syphilitic predominance. Okay, here Robert is telling the pinworm, the seedworms are of tubercular origin. Underline this. At that point of time, we were unable to find this, and one of our students have found later on and posted in the group that this worm affections, pinworms and seedworms are of tubercular origin. Next.
The characteristics alteration of symptoms in the tubercular patient may be noted in the alteration of rectal disease. With heart, chest or lung trouble, especially in asthma or respiratory difficulties, very often operated or suppressed hemorrhoids will be followed by asthmatic manifestation, often accompanied by heart troubles.
Heart troubles alternate with hemorrhoids. Which medicine?
Calcaria cause.
calcarea fos. Okay. Fistula in ano alternate with chest symptoms. Fistula in ano alternate and calcarea fos is a tubercular medicine, anti-tubercular medicine. I cannot concentrate today. There is so much noise. I don't know what they are doing. They are building or doing something. Go to this Colin Sonia. Colin Sonia. There are heart troubles with heart symptoms and piles are associated. Okay, right there. Heart symptoms and piles are associated. After heart is relieved, old piles reappear or suppressed menses return. After heart is relieved, old piles reappear. Underline that.
In the rectum, strictures, sinuses, fistulas, and pockets are all the tubercular origin.
Underline
But
this.
but these conditions are much more frequent and in much aggravated forms when combined with the psychotic miasm.
Yes.
Cancer manifestation of the rectum are a combination of tubercular and psychotic.
Underline this. Tubercular and psychotic. What does this mean?
Trimasmatic. Sora and psychosis.
Sora, syphilis, and psychosis. Cancerous manifestation are so common nowadays. Rectal cancer is so common nowadays.
In
Next.
other words, they are a manifestation of combined destructive force of three stigmata. Sora alone never reaches to pathological changes, yet without the soric element, malignancies will never develop. In
Underline
the
this. Underline this. Without the soric element, malignancy will never develop.
urinary tract, all the stigmata may manifest
I want
themselves.
you to go to aphorism number 205. Aphorism number 204. Sorry. 205. Footnote.
I cannot therefore advise this one, sir.
Yes.
I cannot therefore advise, for instance, the local extirpation of the so-called cancer of the lips and the face, the product of highly developed sora.
Underline
The
cancer
product
of the lips and face. Cancer of the lips and face. Underline the product of highly developed sora. And the sixth edition, what Hahnemann is saying, read that.
the product of highly developed sora, not infrequently in conjunction with syphilis.
Okay, not infrequently. Again, this is a negative sentence. By that we mean not frequently. It is with the conjunction of syphilis. Underline that. Conjunction with syphilis. Sora and syphilis producing this cancer of lip and face. This is example
But
Hahnemann is giving. So Hahnemann was aware of that. Hahnemann was aware of that. It is not that Hahnemann was not aware of tubercular diathesis. Later on, he was not aware of the combination of sora or syphilis. Combination of sora, syphilis, or psychosis, and what type of disease these may produce. Hahnemann was quite aware. It was the later authors who elaborated that idea that this is tubercular state. This is the combination of sora or syphilis. There is combination of sora and psychosis. Later authors have just elaborated the fact which was observed by Hahnemann himself. Next.
in the urinary tract, all of the stigmata may manifest themselves, but most frequently these manifestations are soric and psychosis. Here also
Next.
the combined Combined assault of the three stigmata are represented in the malignancies. The diabetic
Underline
patient is
in the urinary tract, any cancer of the urinary tract you are finding, actually any of the cancer anywhere are combination of all three myasm. Okay, but depending upon the location, if it is in the urinary tract, you may say that it is a predominantly psychotic with psora and syphilis. If there is a cancer in the brain, you may say that predominantly syphilitic with psora and psychosis. Okay, depending upon the sphere of action of the different myasm. Next,
the diabetic patient is as a rule strongly tubercular. Sometimes in
underline this.
this condition,
Underline this. Now, according to development of diabetes, okay, you see that some patients are suffering from diabetes at an early age. So it is will be predominantly syphilitic. Okay, some patients are developing diabetes at an older age. Okay, diabetes development at a age, it is the general disease for known for after 40, after 50s, after 60s, like that. So this is a age related, and it will be predominantly psoric. But it is, if it is developing earlier, okay, childhood diabetes, we know because of the defect in pancreas, or because of defect in insulin manufacture, insulin dependent diabetes. Okay, those are actually syphilitic, predominantly syphilitic. But as a rule, Robert is saying that as a rule, diabetes is a tubercular origin, having a tubercular origin.
sometimes in these conditions there is a strong taint of psychotic, which makes the condition much more malignant. We never see marked tissue changes or fibrous growth without the presence of three stigmata, although the tubercular and psychotic are represented in the majority of the cases Bright's disease.
Bright disease is nephrotic syndrome, older name for our nephrotic syndrome.
While the psoric element is present in these conditions, it is not in as marked degree as syphilitic and psychosis. Nocturnal enuresis with the aggravation during the sleep soon after falling asleep are tubercular, and nightly emissions are also a combination of syphilitic and psoric taints.
Next,
Usually, prostatic troubles may be classed under the union of the two stigmata.
underline this. Prostatic trouble and these two stigmata.
Syphilis seldom attacks the ovaries of uterus
Or uterus. We are
or
not
the
reading. Mostly we are just reading haphazardly. Try to read with your eyes and with your mind.
okay, sir.
There is no
In,
hurry.
pa- in pathological conditions, we occasionally find a manifestation of
Syphilis seldom attacks the ovaries or uterus. Underline this. In previous classes we have discussed that the affection of uterus is predominantly psychotic.
in pathological condition, we occasionally find a manifestation of tubercular diathesis. But this is because of psoric affinity for functional and emotional disturbances and not because of syphilitic influence toward these organs. The syphilitic stigma attacks the long bones. The growing pain of children are syphilitic, especially when aggravates at night, aggravation in storms or on change of weather. The
Underline long
stig-
bones or underlying long bones. The growing pains of children are syphilitic, especially when it is at night. You will get patients in your clinic of children complaining of bone pain at night, particularly. Think of some anti-syphilitic medicine. Okay. Now, again and again, I have told you that summary chapter of this disease classification is important. The last chapter, chapter number 31. We have read that chapter. The one of the sphere of action for syphilis miasm is long bones. Go to Mercurius, you will find this. that affection of the long bone. Acid flow, affection of the long bone. Asafoetida, affection of the long bone. You will find in all the antisyphilitic medicines affections, necrosis of the bone, affections of the bones. Next.
The stigma causes destruction of the tissues partly because it hampers assimilation of necessary elements. We see the result in decades of children. They cannot assimilate from their food what they require to make the bone sufficiently hard to support their weight without bending. The nails of patient are characteristics, being paper thin, spoon shaped and bending and tearing easily, while the nails irregular, brittle, break and split easily, and with many. This is an unfailing sign of tubercular. These
Underline this.
nails are
Unfailing sign of tubercular. Paper thin nail. Have you seen nails? Why we see nails of patients? Psychotic nails. Psychotic people will have nails with ridges in that. Ridges in that. Hard nails, rigid in that. Ridges will be there. Paper thin nail will be of tubercular. Okay, which is brittle, breaks easy like graphitis. Next.
These nails are also spotted or with white specks and scalloped edges. Phelons about the nails are a manifestation of combined effect of syphilis and sora, as all as are all periosteal affections. The
Next.
soric syphilis patient cannot endure much cold, yet they cannot endure much heat. The heat from the stove may drive them from the room. Chilblains are a combination of all the
Again, child
stigmata.
blame. What is, read it correctly?
Chilblains. Chilblains.
Chilblains.
Children.
Chilblains. What is chilblains?
Frostbite.
फ्रॉस्ट बाइट. फ्रॉस्ट बाइट. बहुत ज्यादा ठंडे मौसम में अचानक से हाथ सुन हो जाता है, नीला पड़ जाता है ना, या कोई भी बॉडी का कोई भी पार्ट आफ्टर एक्सपोजर टू एक्सट्रीम चिल. आफ्टर एक्सपोजर टू एक्सट्रीम चिल. Chilblains are combination of all stigmata. Name a medicine where we will have chilblains.
Agaricus muscaris.
Very good.
Abrotenum.
Abrotenum. Very good. One of the useful medicine, लिखा तो बहुत सारा medicine रहता है. Useful medicine is agaricus. I have heard a case of one of my teacher that after visiting the Darjeeling, okay, Calcutta patient, after visiting Darjeeling, and he have chilblains, frostbite on his head, and after coming from there, he got alopecia. Okay, several alopecia spot, several spots were there after chilblains, and our sir prescribed him agaricus on the basis of extreme exposure to cold and chilblains, and that patient recovered. Next.
Anyone who has endured the torments of this affliction can readily understand how willing these sufferers are to accept any form of treatment which promises some relief. Yet a suppression of this manifestation brings in its train a succession of all sorts of nervous diseases and many other serious conditions, even to malignancies.
Okay, what we have read in agaricus, there are so many nervous symptoms. Next, we will read from next day onward and we'll discuss. Okay. Now, if you have any question, you can ask. For next 5-4 minutes, we will try and answer those questions. Okay, we will read it onward, from here onward, next day. Just remember. Okay. Thank you very much for giving your attention.
Thank you, sir.